Thank you. To the Minister for Health. There's currently a proposed revision of the National Environment Protection Ambient Air Quality Measure to strengthen the ozone, nitrogen dioxide, the sulphur dioxide national standards. Children are most vulnerable to air pollutants, as are the very frail, elderly and asthmatics. The recent Infrastructure Australia Audit report found that Warringah has some of the most congested roads in Australia, but there's no regular air quality testing to notify us of the pollution and health risks caused by congestion. Health experts are recommending the expansion of the network of monitors with daily monitoring of key pollutants and adoption of a much stricter national standard for ambient air pollution. Will you, as Health Minister, endorse these stricter health-based standards for air quality?
The Minister for Health.
Thank you very much, Mr Speaker. And I thank the member. We discussed these matters earlier this week, and as I indicated, there are a number of important steps. One, as a government, we have moved to lift air quality standards in Australia, in particular, as I recall, from a previous portfolio by strengthening across the nation the standards for PM10 and PM2.5 in relation to air quality. The Environment Minister may have a more up-to-date account of that. As part of that, we moved across the country to ensure that those standards were being implemented by all of the states. We, in particular, made clean air a fundamental element of our work as a government over the last 6 years for two reasons. One is because it was the right thing to do for health. Two is it was the right thing to do for the environment. So we have continued to do that. One of the essential elements in doing that is not just monitoring, and I am always happy to support additional monitoring in this space, as I indicated when we met this week. But two, we have a $4 billion urban congestion plan. The Minister with responsibility for this, the Minister for Urban Infrastructure, is overseeing that and cannot work fast enough with the states to get these projects delivered. In particular, not only are these projects important for urban congestion, they're important for reducing impacts on air quality, which would otherwise be detrimental to health. So I respect the question. We have set in place a national standard. We have been one of the global leaders in terms of air quality and health. We have, in particular, put in place standards for PM2.5 and PM10. We have put in place a national approach there, and now we are working on reducing the source of those pollutants through the $4 billion Urban Congestion Fund, and I think that will make a real difference, not just in the members' electorate, but in electorates around the country.